Hi, I'm Dr. Balwanz. I'm a cardiologist here at Bryan Heart. I'm from Omaha and I went to UNL for undergraduate. After completing undergraduate, I went to UNMC for medical school. After completing medical school, I went to University of California, Davis for residency. And upon completing that, I went to Kansas City and completed my cardiology fellowship at the University of Kansas Medical Center. And I'm happy to be joining Bryan Heart. When I first was introduced to medicine, I was mostly drawn to very complex patients in an inpatient setting. Thus, it was natural for me to be drawn to very complex cardiovascular issues. As I progressed through my medical training, I learned that the relationships you build with your patients as you follow them over the years was an even bigger draw, especially for those that we follow in our cardiovascular clinics. When I care for patients with a variety of cardiovascular issues, we try to do our best to approach it as a team and try to make the patient feel comfortable, but also feel confident that we're going to give them the best care that they can possibly receive. That involves anything from high-tech procedures and imaging to just sitting and listening to the patient's concerns and giving them all of our attention and trying to give them the best quality care possible. Cardiology is a very broad specialty. I have many interests within it. Some of those include special scans called CT scans or MRIs that have special technology that helps us image the heart even more clearly than we've been able to in the past. Another specific interest of mine is not just the heart with cardiology, but also with cardiovascular diseases, specifically with vascular ultrasound. All these different imaging modalities help us image the heart in many different ways that helps us treat patients to the best that we can. I've had the opportunity to train at a lot of amazing institutions in different states and around the country, and it's very special for myself as well as for my family to be able to come back to Lincoln and the surrounding communities and help care for Nebraskans throughout the state. I think the openness and friendliness of our patients helps us to give them the best care possible. I feel that our entire team, all the way from our administration to our nurses, to our physicians and surgeons, to our support staff, are committed to helping our patients feel the best they possibly can and have a great quality of life.